So working in the Department of Health, the New Jersey Division of Family Health Services, really gives me an opportunity to address health equity. We see health equity as being something that comes out of, unfortunately, racism, discrimination, and just unfairness. And so much of the work that I do and my life's work has really been committed to addressing disparities in health. So if you ask me about if there was a woman in my life who inspired me or encouraged me to get where I am today, I have to cheat a bit and talk about two women. The first person would be my mother, who came to Canada as an immigrant, as a graduate student, and really raised myself and my brother to be who we are. So she was instrumental. But more importantly and recently, I'd like to talk about a colleague that I lost to COVID-19. Her name was Colette Lamotte Galette. We worked together in the department for 15 years, and she was very inspirational and a big time encourager to me and my best friend. What I would say to someone following in my footsteps are many of the things that Colette said to me as a friend and a colleague. Things like be brave, be courageous, be bold, and certainly be your authentic self. Come to the table with who you are, and don't hide that, because who you are really contributes to the solutions that you'll look to find and really tells your story. COVID-19 and its impact to my work has been so far and so wide. I work at the Department of Health, so you can just imagine what it's been like working through this pandemic. My division specifically really works on family health services, so babies continue to be born, folks still need WIC, early intervention is still a much needed service. So we have really tried to reformat ourselves to be responsive to the pandemic, but to make sure that we maintain the safety nets for families that are so critical and so needed. I will continue to advance the mission of YWCA in so many ways. The work that I do really provides a safety net for communities that are often vulnerable and at risk. So I will continue to do that. One of the projects that we're working on is creating a workforce of community-based doulas. And those are supports, mother supports, people that will advocate, that will stick by your side. And I say that because what I've seen a lot through the pandemic is the critical need for social supports. This pandemic has really isolated us. So we've tried to be creative in the way that we create social supports for people, safety nets through Zoom, through webinars, and really just connecting with people. So I pledge to continue to do that, hopefully in an environment soon where there is no pandemic. But in the meantime, I will continue to connect and link communities to services and care as much as I personally can.